Good morning or good afternoon, depending on where you are in this country. Welcome to the webinar, An Industry in Crisis. Can payers and providers care as one? Lots of stuff to talk about, really exciting. This is Dr. David Nace, Chief Medical Officer here at Innovaccer, and I will be moderating today's panel. And really excited about this particular presentation during this time that we are all worried, wondering what's the future is going to be for healthcare. First, before I get started, however, I would like to give a couple groundkeeping rules. So we will be taking questions at the end. So please enter any questions you have during the webinar into the chat box, the XXX. We will use those questions toward the end to bring up questions to our panelists as we go along. So with that, let me introduce our speakers for today. So first, I'm very pleased to introduce Fran Soistman. Fran most recently was Executive Vice President of CVS Health, Aetna. Long career through that whole acquisition strategy that led to the combined entity, and is currently President of the Healthcare Management and Transformation Advisory. Fran, welcome to this webinar.
Thanks, David. It's good to be here. Welcome to everyone, and I hope everyone is safe and abiding by the CDC guidelines out there.
Awesome, awesome. Good to have you here. And Patrick Conway, who most recently was President and CEO of Blue Cross Blue Shield in North Carolina. And formerly, many of us know him, where he was at the CMS as Chief Medical Officer and Deputy Administrator for the Center for Medicaid and Medicare Innovation. Patrick, welcome.
Yeah, it's great to be here, David, and thanks everybody for joining.
Awesome. So, I mean, these are very, very difficult times. So we have a lot to talk about. You know, there's a global pandemic. There's a large, if not the largest number of cases now, new cases in the United States, $2 trillion stimulus bill. We've been relaxing telehealth regulations, and macroeconomic changes are occurring everywhere. We're all worried about the economy, our own portfolios, wondering if our healthcare system is stressed to the breaking point. So with that, I just want to first ask, you guys are probably quarantined at home. How are you guys doing? Fran, let's start with you.
Well, thanks for asking, David. I'm doing fine. You know, it is a different kind of pace and environment, not being able to socialize like I'm accustomed to. Families stressed, younger children, I should say adult children, but nevertheless, they've been affected by this. They're in college. Disappointment. One is graduating, commencement canceled. You know, they worked hard to get to that point. So I'm sure many of you are out there are experiencing the same kinds of things, and you know, things we never ever anticipated are now we're faced with, and it's our new world. But you know, we'll get through this, and that's the message that I convey to my family, to keep their spirits as high as possible.
Yeah, thanks for that. And I think many of us would feel the same way right now, depending on where we're at. Patrick, how about yourself? How are you doing?
Yeah, so we're home in North Carolina, and have been for a few weeks, and 4 kids are doing virtual school. So yeah, I mean, look, I just would want to recognize the healthcare professionals on the front line. Yeah, I still work as a physician, but very intermittently now, and we've got a lot of people, including many that I know, serving on the front lines each and every day during this crisis. So just want to thank them for what they're doing on behalf of patients.
Yeah, that, you know, I really want to reiterate that. I saw a little story on the news last night about a police officer who pulled over a physician who was speeding on her way to the hospital. He was pretty strict with her and stern in his warning about speeding and the dangers of speeding. He walked back to his car. He came back and he offered her a 10-pack of his own N95 respirators and said, "Good luck. We need you." So, you know, it's really, really great stories to see the kind of people coming together. So with that, let's get into it. So this is a historic move, right? $2 trillion stimulus plan, offering lots of relief for lots of different things, a one-time, you know, direct payment for individuals and couples, a little bit more for children, you know, requirements for health plans and insurance to provide preventative services related to coronavirus without cost sharing, tax credits, so on and so forth. We've never seen a stimulus package like this. So how much is this going to help? That's the big question people are asking. And are we going to need to do another one at some point? Patrick, your position, let's start with you. What's your perspective?
Yeah, so I'd say a few things. I think one, yeah, obviously, as you said, historic package. So I think a definite move in the right direction. I think we've also seen CMS and others relaxing regulatory requirements to allow people to care for patients. You know, that being said, I think we'll have to continue to track and monitor. You know, to give a tangible example, you know, I'm very worried. You know, you've got, for example, smaller health systems and independent primary care and specialty care practices across the U.S. that generally have a low amount of reserve capital, and a hit like this could really take a dramatic negative impact, for example, on independent primary care across the U.S. And I think all of us will have to band together, if you will, to support the health system we want in the future, support physician practices across the U.S. and smaller systems as they transition through this, both at the federal level and, you know, across other payers, for example. So I think more to come on this, but a definite step in the right direction.
Fran, you have a long career on the health plan side. What's your perspective? Is this going to help?
Well, it certainly will help. Despite the fact that it's a historic package in its size, I think we have to recognize it was done at a time very early in the process where the uncertainties were, you know, enormous, and they continue to be significant. That I think it's highly likely more is going to be needed in virtually every category, and probably some categories that weren't considered the first time around. You know, I think about what's happening. I'll use Hong Kong as an example. I was reading earlier today, they're sort of the first to come out of lockdown, and there are already an incidence of recurrence of COVID-19, and that's going to be our world at some point. You know, we've had a just-in-time PPE approach, and what's the cost of changing that, and who pays for it? So the stimulus was an important step, a critically important step, but that was before the unemployment numbers came out. They were far greater than anyone expected. I think we're going to need more. I think it's going to take a lot longer for things to come back, and therefore, you know, Congress is going to have to address this again.
No, it seems to be a consensus amongst quite a number of people, particularly with seasonality that occurs, which is also likely. So, I mean, these are great perspectives, and, you know, I think many of us have been thinking about this and wondering as we don't know, but let's go to the level of a patient, right? Family. You know, their out-of-pocket costs are going up. Many of them have lost their job or feel their jobs are threatened. You know, historically, individuals have more out-of-pocket costs to begin with in this country, but we've been, you know, relatively a fairly wealthy country overall. But right now, we've got people incurring costs, huge costs, even as a result of just being quarantined in their home, and, you know, not being able to be discharged from a hospital or whatnot. And, you know, we've tried to make the test for coronavirus an essential benefit, but, you know, this is going to be pain for patients and families. I'd love for you each to comment on that. Just kind of give your perspective of, you know, what it's going to be like for patients and families, and how should they think about it. Fran, let's start with you.
Sure. Well, I think we have to really attack it kind of by segments. in the commercial population, we have self-funded employers who they're the ones who are going to have to think about, what they're prepared to do, because they're in a position where they could waive much of the cost sharing if they so choose. The health plans are really the administrators of these programs. So then you have the fully insured side where the health plans are at risk, and many have already stepped up to waive various components of the cost share, whether it's the co-pays or the co-insurance or some elements of the deductibles. You can read about those in the public domain. And then you have the Medicare side, the original Medicare and then Medicare Advantage. And the federal government could certainly do something, CMS could do something on the original Medicare, and Medicare Advantage plans could certainly do something. Medicaid, I think, is the least affected because there's very little out-of-pocket cost sharing arrangements with Medicaid. So I think it has to be attacked by segments.
Patrick?
Yeah, so I mean, I think obviously both the health, social, and financial concerns are dramatic for individuals and families across the country. First on the health, I think, how do we meet the huge health demand and people worrying about the effect on themselves and their families? I think on the social, including mental health, how do we support individuals and families through this, including virtually and through various platforms. And then on the financial side, as Fran said, I think, how can payers, employers, whether it's through co-pays, deductibles, leave and support from employers, how do we really provide the financial backing and support that individuals and families are going to need through this crisis? And so I think, it's going to be an across the board set of solutions we're going to need to address these individual and family needs.
That makes sense. And, a lot of families are just worried about the costs this may incur to them. And, much of that will come from the reception they get, right? When they call and they need services, they need help. I've been thinking about this in terms of both the impact for providers as well as payers. And right here in San Francisco, we're experiencing where the providers are feeling like they're not getting the support they need. We have a 20% increase in Medicare reimbursement for cases. We've got still a loss that we see financially for providers. When we think about how this is going to play out in the future, some people have said that it'll be a reemergence of a gatekeeper model or, some form of tighter care management because they got to restrain costs. And Patrick, you've led, a charge toward moving toward value-based care, as have you, Fran, for quite some time. So, what do you think is currently needed in the next 6 to 12 months? A continued focus on value-based care or a move away from it?
Yeah, Patrick, maybe I'll start and Fran can add in. I don't think it's a move away from it. The way I would, if I were still at Blue Cross North Carolina, the way I'd approach this is, how do we support the hospitals, the doctors, the clinicians through this crisis? And that is everything from, waiving certain rules so telehealth and virtual care can be maximized, to front loading payments, to, every way we could support them through the crisis. And I think the value-based care push will continue. Might you waive two-sided risk because this was an unexpected hit and you acknowledge that? Yes, I think you would definitely want to take a look at that if I was in North Carolina right now. So I think it's a partnership model. I do think I think this is going to dramatically impact how care is provided long-term. So, I would argue sort of virtual care and telehealth has always been at the periphery. Right now, I think we have an opportunity to redefine how you deliver care in the home, both in person and virtually. How can telehealth and virtual care really support whole people's needs and sort of across the whole care continuum? So if there's a positive that might come out of this, I think it could have a dramatic positive effect in sort of really pushing telehealth, virtual care, care in the home, dramatically more forward than it would have been had this not happened in a short time. And I think it could do that in a short time frame.
I couldn't agree more with Patrick, that particularly the last part of his statement. The pandemic, if we've heard it once, we heard it 1,000 times from Governor Cuomo, as well as what we're hearing from Washington and Louisiana, and probably other states will follow as the pandemic really starts to explode in other states across the country, is that there is a capacity challenge here. And the answer isn't to build more hospitals and add more beds for what might be, periodic demand. It's really about how do you repurpose what's provided in the home, and how do you do so with technology and support it with having a better model that rewards clinical professionals to see patients in the home. And I think that's goes hand in glove with value-based care in my mind. And so I really think that's where the emphasis needs to be placed, because I don't think we're going to be out of the woods with COVID-19 for any time in the near future. It could be every bit of 12 to 18 months, and who's to say that there wouldn't be something that follows down the road? Another virus that could be just as bad. So I think we have to face the reality, particularly with the graying of America and another 20 million Americans aging into Medicare eligibility over the next 15 years. We're going to be up to over 83 million Americans over the age of 65.
So, it's interesting. You've had a long experience on the payer side, and Patrick as well more recently. I think I was on calls with at least 4 or 5 different CEOs or other executives for some of the largest health payers in the country yesterday. Interesting, they're experiencing a couple of things. One is they can't get the attention of their usual calls and meetings with their large network providers. And then they're very concerned about this issue about the inquiries that they're getting. Am I covered? So on and so forth from members. And they're expecting a lot of cost of care to hit them. People have said, will that end up in more narrow networks again, or restructuring of their customers' employer benefits? Fran, how do you think right now, for the next 6 months, payers should be thinking about this?
Well, it's going to be interesting. Let me say, right up front, that I don't have any inside information on this. So I'm speculating in terms of what the actuaries might be thinking in terms of how they're going to be developing their rate models. First they've got to anticipate how the current pandemic is going to play out, how long it will, how long the tail will be, and how severe it will be in terms of its effect on their particular population. And then you have sort of the pent-up demand of all other services that weren't affected directly by the COVID-19, but services that weren't provided because there was, discouraging to have those services provided at this particular time. So that could be delayed either later this year or into 2021. And so, they have to think about building that into the rate models. So you could see larger trend increases proposed for the future, and that never sits well with employers. And trust me, payers don't like delivering that message. So they're going to have to be thinking of ways to mitigate that. And obviously, there's different different things they can offer. And, network is certainly one, not one that they necessarily like to have to introduce narrow networks, because it can be disruptive, and people like choice. Consumers like choice. Benefit plan designs, the higher deductible plans, I think it's fair to say, have not lived up to what people thought they were going to do. In fact, they may have done more harm than good. So, I think it comes back to value-based, and in terms of, the payers and the providers working closer together to drive better outcomes, find ways to eliminate inefficiencies, defects, and we really have to focus there, because I think squeezing the benefit plans more is just not the right answer. It really isn't.
No, that's really insightful. And to that same point, Patrick, you've spent a lot of your career trying to think about this payer-provider collaboration and thinking about more value-based models that require collaboration, right? The two-sided risk that people are moving toward is a perfect example of where it requires that kind of collaboration. So think about this today. As we're moving into that, and the payers can collaborate with providers right now, how might they help in regard to these fears that everyone has, payers, providers, families, around this impact of this epidemic? How can they best collaborate?
Yeah, I mean, look, and as you alluded to, everybody comes with their own perspective. I think the sort of payer-provider collaboration is critically generally to drive our health system change we want. I think even more important during a pandemic like this. So to give some more color and emphasize some points there, I think through the pandemic, it's everything from financial support to payers making sure rules aren't getting in the way to, even thinking about, are there ways payers might have staff that could deploy for a short time, even clinically, because payers have a lot of clinical staff. So I think it's thinking about all the levers on private payers. My previous CMS role, and I still talk to folks in the federal government, including at CMS, it's the same. How do you pull all the various levers to support providers? Longer term, I think you're seeing a trend that will continue and I think accelerate, of payer-provider collaboration where they become very mixed. Whether you call it payvider or whatever term you want to put on it, payers that are increasingly providing care, providers that may become payers, or in many examples, and this is what we were doing in North Carolina, we were not a single organization, but we were trying to build a virtual organization that was caring for people. So if you thought of something like Blue Premier, which was our big partnership with large systems, it was, how do we work on behalf of the patients and the people we serve to deliver a better quality, better experience, and lower total cost of care? And how do we share in that? How do we decide who does what? How do we have the right data flows? How do we, have a payment model that supports that? How do we have a trust and a culture that is really centered that way and is not adversarial? So that I think those same sort of principles are going to be at least, if not more important, post this pandemic.
Yeah, thanks for those comments. As people think about kind of rebuilding trust and rebuilding our healthcare system in a different way to be more resilient to this, there's a lot of focus on virtual care, telehealth. I can't, in the past 3 weeks, this is all I hear when I'm talking to providers, payers, what they're doing. Many practices I talked to, even just yesterday, are just incorporated telehealth capabilities into their practice. And we've all talked about for years of new settings of care and how do we connect people, make things interoperable, have people operating on the same page. What I would like to do is have a discussion about that, but first let's ask our audience kind of where they're at right now with trying to use technology. So we're gonna have a little poll that comes up. For those in the audience, just go on and take your poll. A couple questions, just select all that are true. So you're not using technology in responding to COVID-19. You're using technology to screen and triage patients. you are using telehealth to virtually meet with patients, speak with them in their homes, or you're using technology to automate your outreach and maybe even using bots and artificial intelligence, things like that. So why that's coming up, let's have a little discussion while we're waiting for people to answer. Start with you, Fran. Role of technology. We've all talked about this, virtual healthcare. Are we gonna have a new healthcare system when we come out of this?
I think inevitably, we've been evolving that way for the last probably decade. I think it's likely to accelerate. I think Patrick and I are pretty much aligned in our thinking about how it is evolving. I think that the days of well, at least I'll say in the last 10 years, I've seen what used to be a lot of tension between payers and providers mitigate tremendously. And while there's still, periodic examples of it still being in existence, it's not nearly as prevalent. So I think that bodes well for, strong collaboration and finding ways to, find that win-win-win. And the win-win-win is defined as the provider wins, the payer wins, and the customer wins, the consumer wins. And that it has to be a three-way win. And this crisis that we're managing through right now is really going to be, I think, a national wake-up call. This is where we as a nation always rise to do our best, is when we've got a crisis. And I think there's going to be so many new innovative solutions introduced that's going to advance things faster, things that probably have been on the drawing board that have just not been able to get off the drawing board. Now they're going to be accepted and executed. I just think that there's a greater sense of urgency now because of what we're dealing with, and a greater sense of reality of the economic consequences. There's a lot at stake here. We cannot be caught flat-footed again, and everyone's going to have to work together. So I really think there'll be a renewed spirit to build a better healthcare system, defined as, in the broadest sense of the word, where payers, providers, consumers, customers are working much more harmoniously in the future.
No, that makes a lot of sense. Let's take a quick look. It looks like our poll is done, and pull up these results and see what people are doing. Here we are. Interesting. Patrick, what do you think of these results? Surprising?
No, I mean, honestly, probably about what I would expect, just sort of tick through them. I think, using telehealth to virtually meet with patients, I bet it wouldn't have been 76% a month ago for COVID-19 or generally. So my guess is the number went out a lot, but for COVID, that makes sense. I would guess it will go even higher over time. Screening, I would have thought might have been a little higher, but, once again, I bet it's trending in the right direction. And then, in the automation for large organizations, my guess is they're using automation maybe a little less for smaller organizations. But, I think my takeaway here is the sort of the green, purple, and yellow bars probably have all gone up significantly over the last few weeks and will continue to go up over time. And then I don't think they'll drop back to their pre-level, beyond COVID-19. I think you'll see more technology to screen and triage patients, telehealth, and technology to automate post-crisis as well.
No, that
so
makes
it doesn't go back to baseline.
That makes a lot of sense. We often think about in innovation, right? There's a lot of business school that discuss this, like when certain things reach a tipping point, and we've all read Malcolm Gladwell's book and, spent lots of time thinking, when is this going to happen, this tipping point? And, one of the questions will be, as we get through this, and that may take time, will our notion or concept of value in healthcare evolve, right? We've had debates about should it be a single government, role, a single government health plan, should the role of social determinants, Fran, you've thought about this in the payer landscape. Do you think all of this will catalyze a change in the way we think about what value is?
I think it has to. I mean, we've evolved value. In fact, I think we struggled early on in defining what is value, and I'm not sure we're still quite there, because value to in the mind of a provider is going to be a little different than value in the mind of a payer. It's going to be different in the minds of a plan sponsor, and certainly in the mind of a consumer. But what we have to, instead of, kind of fighting over what it is there a common definition? Because when I was on the healthcare transformation task force, what I was proposing is, look for the common theme and not get so hung up on it has to be identical, because I don't think there is, I don't think we're ever going to get there. But there's commonality in sort of a theme, and that's what we should rally around. That's what I would propose.
No, that makes sense. And, Patrick, you've thought a lot about this, right? What's value? You've gotten input from lots of different stakeholders. And we often think about this whole idea of innovation requiring this wheel of identifying goals and designing things differently and then assessing whether they work. And you did a lot of that at CMMI and also at Blue Cross. How do you think this will evolve? What is your perspective about this movement in value-based care and as a result of all this?
Yeah, so I give a few thoughts. I think historically, like in the past, I think you had sort of quality experience over cost, and quality historically was more really quality of care. Experience may or may not have really been measured, and sort of cost, the trends in costs in the country have not been positive at a macro level. I think we're evolving now where quality is a broader sort of health outcomes view and population health view. Experience, I think we're measuring more reliably. And I think cost still remains to be seen, but I think there's definitely more of a focus on total cost of care and true affordability to individuals, families, and employers. I think the way this will evolve, I think that focus will remain the same. And Fran's point was a good one. I think we've struggled with value to whom, and let's define it crisply. I think, in an ideal state, we'd really get to value down to that individual family, like the buyer level. Like, what do I value? And therefore, what is value to me? And we're going to measure that reliably and reward that as we do in other markets and sort of decision processes. I don't think we're there yet, but I think this will push us to get closer to there, where you're really defining value to a higher level of fidelity, if that makes sense, and closer to the real purchaser of care. I'll give you a little longer answer on this one, but, could there be products developed that are, how do you deliver care to people in their home that, they really want to have as close to as possible full in-home care delivery, either for personal reasons or they're homebound or, whatever their sort of reason for wanting a more in-home and virtual experience, that we build products around delivering that to people. I think that's a real tangible possibility post this environment that probably wouldn't have happened as quickly if this hadn't happened. So this is obviously a horrible series of events, but I think our collective challenge is how do we manage through it, and then how do we create some positive opportunities and changes from our learnings, if you will.
Fran, your thoughts, particularly around this concept of, thinking more of a public health perspective and changing the concept of value?
Well, I think this pandemic has really brought into focus the public health aspect of healthcare. I mean, we're living it live right now, right, with social distancing. It is the epicenter of this whole thing. I mean, every part of our lives has been affected by this, by COVID-19. I never would have dreamt that we would be confined to our homes and limited to, visits to a grocery store and the pharmacy, and that would define, kind of our lives over the last several weeks and probably through the end of the month of April. So public health, um, it has to be front and center now. I think we if this isn't the the case to demonstrate, I don't know what is.
No, I think many of us are thinking the same thing. And the question is, do we get there? It's so interesting. Just before this happened, right? We've all talked about this role of, Patrick, your comments about new products, deliver care in the home, and all requires technology, right? We're all using Zoom every day now just to talk to friends as well as business or some other services, other connectivity services. And the internet's holding up. And so there was this release of the interoperability rule, the continuing motion, the use of APIs, leverage people to use whatever app they want on their cell phone, greater connectivity, and a relaxation of telehealth, particularly around this issue of delivering care in the home. There's even a question that came in from the audience, like, do we believe that that relaxation in the telehealth rules and HIPAA rules, will that become permanent? Curious to see in the next year your thoughts on that, Patrick.
Yeah, so I think it's definitely possible. I don't lead CMS anymore, and some of them are statutory and regulatory. But if I was at CMS and I'm guessing, and I think probably many of the folks there right now are having these thoughts as well, I would certainly contemplate which of these waivers and other regulatory flexibility we put in place should become the new norm. And so my hypothesis is CMS and HHS will do that. And I think it's the right thing to do. Some of the changes you need are statutory, so Congress would have to take action. I think once again, I think this opens the door for that to happen. So, I think the push towards interoperability will continue. I think with it's a bipartisan ideal. I think telehealth, which it actually always frustrated me a little bit when I was in CMS that we couldn't push telehealth further, and whether it was waivers or statutory changes, it just seemed very hard to get them done. I think this will push those sort of regulatory and statutory changes farther much faster, and I think some of them will become permanent, and I think that's a positive for our health system. Can I say one of the, just on the public health infrastructure, I would just echo Fran's point. Like this, we knew it before this happened. We sure as heck should know it now that this happened. We have underinvested in our public health infrastructure as a nation and at a state level as well. So both federal and state and community. Hopefully this will be a wake-up call that the level of investment you're talking about in the overall federal budget is actually relatively minor. So I hope that we heed that warning and invest in the public health infrastructure going forward.
Yeah, we've actually, one of the things we've done here at Innovaccer is support a number of these accountable communities of health that have brought healthcare and the community organizations together. And, it's nice to see that movement. Fran, your thoughts? I mean, you mentioned that with social distancing, right? We've got new ways of thinking and working and, a lot of this relaxation. What are your thoughts on this future role of technology, telehealth in healthcare?
Well, I think the one caution I have is that there are going to be things that are missed in telehealth, and I just would encourage um, patience, I guess is the word. It meaning that this will continue to evolve, and the protocols will continue to evolve, and let's not throw the baby out with the bathwater. It's new, and it's being used at a time where we have a crisis, and it's filling a critical need. So I just want to make sure that the anecdotal the bad experience or the bad story doesn't sort of take on a life of its own, and because inevitably it's gonna surface. I can guarantee it. So that's sort of a kind of a caution I'll put out there. I'm a proponent of telemedicine, telehealth, but it has to have a strong governance process backed by clinical protocols. And I'm not a clinician, so I'm not here to suggest what they look like, but the experts should put them in place, and there should be a good management process with good reporting, and demonstrated outcomes that can compare and contrast, what telemedicine, telehealth produces in the way of outcomes relative to an in-office visit, so that there is, the ability to determine, are they comparable, better, and hopefully not worse. And I don't think they will be. So I guess the short version is the technology should it should lead to better outcomes, lower cost, and a better experience for the patient consumer.
That's the definition of value-based care goals.
Bingo.
So it's a great question. Like, how are we going to achieve that? How are we going to align everything? And I'm going to use this opportunity to bring up some of these questions that are coming in. There was a question specifically for Patrick. Like, can you address the issue of 50 different state Medicaid efforts addressing COVID-19, just as an example, right? What we may face in the future versus Medicare being very centralized, and this whole role. How do we become more about public health? Like, what are your thoughts about that?
Yeah, I can say this now because I'm no longer in CMS. It's one of the bonuses. I don't think this will happen anytime soon, but I think there is a open question. Is the 50 state framework for Medicaid, does it actually make sense anymore? Or would a national Medicaid program make sense? That's a huge political lift. I don't want to minimize that. It's not going to happen anytime soon. I'm not even saying there's pros and cons, by the way, but I actually think it's a good policy question to at least raise. It's the kind of policy question, unfortunately, in the current environment, we don't often have these sort of legitimate policy debates. That being said, on the sort of, I think our sort of issue in COVID, which the question refers to, is, I think what we should try to do is there's some national, at least, floor, and I mean floor in a, these are the bare minimum that just evidence says should apply across the nation, and let's deliver that evidence base across the nation, whether it's social distancing or issues around sort of PPE delivery or what have you. Then I think there is room for variability based on evidence, hopefully, on sort of, some states and communities based on what happens in that state and community are going to need different solutions. And I get in the Medicaid program too, the advantage of the 50 solution is we've been able to test different things. The disadvantage is sometimes that variability creates disparities and other issues. So look, at its core, whether it's through this crisis or value-based care, I think we are on a journey. You sort of alluded to Secretary Leavitt, who used to be my boss at one point earlier. I think he's going to come up in the slides later. Even back when I worked with him in the Bush administration and then the Obama administration, and obviously in the private sector, both on the provider side and the payer side, I think the core challenge we're trying to manage through is how do you have a true learning system that delivers better quality, exceptional experience, and lower cost over time, and is iterating much faster. And I think that's what our customers and patients and consumers are telling us they need. And I think that's the core issue, whether it's during the COVID crisis or post-crisis. So that's what I would say.
Yeah, I think that rapid iteration is so critical, and it's something we do all the time here in Silicon Valley, technology companies. And if you're going to measure, right, if you're going to do rapid iteration, you need data. We've all talked about how we can use technology for a variety of things, not just telehealth, but doing that cycle of innovation, getting the data across what you need, trusting it, testing out new hypotheses, seeing what works, what doesn't work. That's iteration. And then we've got new tools, right, like artificial intelligence and automated workflows. Fran, you did a lot of this perspective, and from a health plan perspective, what are your thoughts about how data may actually help us going forward? Got this interoperability rule, and maybe an opportunity to come out of this crisis with a little bolster of moving more toward connectivity. What are your thoughts about this?
Well, I think that what we've learned when I was with Aetna for the 7 years, data was the key to unlock so many different solutions that either created new programs to help our members, whether it was in chronic disease management or programs that were preventative in nature. Data that is data has to be turned into information, and we've got a lot of data science. We had a lot of data scientists that were just brilliant, and they created algorithms that allowed us to make some, do predictive modeling, and and we were just on the leading edge of so many different things. So I think that provided the data is reliable, and it has to be ideally aligned with the data that you're looking at as a payer is the same data that the provider's looking at, so that you're talking the same language. So I think as we, going back to the collaboration, you want to be able to be aligned in terms of, what you're trying to accomplish with any given patient, and the data is the key to that. So, again, back to value-based, data makes it happen. It makes it happen.
I couldn't agree more. And both of you have been helping us out a lot at Innovaccer, thinking about this. And our concept, as is a connected care framework. How do you actually address on the left-hand side, bringing in data from all these different folks, including communities, right? Community health organizations, the social determinants, and really getting everybody operating. Fran, you said it well, it's on the same record, on the same page, right? And then being able to give decision support from predictive analytics, and having people care as one, working together around the patient, using command centers if you're managing a large population, being able to innovate, with new applications, personalizing the engagement, looking at behavior change for the patients, and nudging, things like that, understanding the personas like Kaiser's been doing, and we've been talking to them about that. And how do you transform practices? I have so many questions that have come in about, is my practice going to survive? It's phenomenal. People are very nervous about this. People, Patrick, you and I talked about this yesterday, that are in downside risk. I appreciate your comments about, maybe alleviating that or providing some benchmark alleviation. People are concerned that they're going to lose their shirts and moving into value-based care. So I think if you connect people and have people, both payers, providers, and pharmacies all working on the same page, it's really going to create a new, different world. And we have cloud technology and other things that allow us to do that. Patrick, you mentioned, as we've been talking now for 45 minutes about predictions of a post-pandemic future, this comment that as part of the Accountable Care Learning Collaborative, which we're a part of here, Secretary Leavitt said, we may see in the days to come something we don't expect, an increase in surprise billing to recoup money, restructuring of benefits, narrow networks, or emergence of gatekeeper models. Any closing thoughts before we ask one of these two questions that have come in, which is now 60 questions? Any thoughts, closing thoughts about what the future might be and what we need to be careful of? Fran, let's just start with you.
Well, I think it's going to take time for everyone to really evaluate the lessons learned, and there will be some that can be moved on immediately. Others will take time. I'm cautiously optimistic that we're not going to do anything draconian, and that the actions that will be taken by all the various players will be done in a spirit of advancing the cause in the right direction. I don't want to repeat my comments from earlier and on the call in terms of narrow my views on employee benefits and narrow networks, but I really think that everything has to be done in a thoughtful way, and not in an emotional way. I really believe that that's likely what will happen. It'll be done in a thoughtful way.
It's funny as we talk about this, and my apologies, I didn't mean to move to that slide. So okay, these questions, Patrick, before you give your closing thoughts, some of these questions, every common denominator is really kind of fear of the future, like what's going, like will there be savings in telehealth? Where will they come from? Physicians are still at risk for malpractice. As a patient, I'm accepting a telemedicine appointment with my provider, but I'd rather see him and I'm being charged the same amount. I mean, all these questions kind of relate to fear, right? Like, am I going to be able to survive this financially? Am I going to get the care I need? Am I going to be able to survive in this new environment? So with that context and backdrop, what positive closing thoughts can you give us about what this may bode for us as Americans in an American future?
Yeah, I'll be brief. On the fear, I mean, my sister is a solo practitioner doc. My other sister's in a 2-doc practice. My brother-in-law is in a specialty practice with about 25 GI docs. I mean, and I've got all kinds of friends in those environments. Unbelievable fear. Like, will not pay ourselves or our partners for the next 3 months, don't have cash on hand. What does it mean for rent? So, I mean, I think there's a whole litany of things that is an opportunity to support. It's not about my sisters or brother-in-law, but all the providers and clinical practices in those kind of environments that have a lot of appropriate fear. By the way, while I'm dealing with huge health issues. I think on the opportunity, I won't say it all again because I know we're close on time. I think there's a huge telehealth and in-home care delivery opportunity. I think there's an opportunity in mental health and social supports to really redefine how you provide integrated mental health care and deliver on social needs. And I think, the work on data flow, value-based care, et cetera, that I know is core to much of the discussion today. There may be we may have to take an appropriate not pause, but adjustment, given what's going on right now. But then I think that work will be at least, if not more important in the future.
Yeah, that's great. And, I've been very positive about what I've seen. I mean, this is truly a sense of Americans coming together. I can tell you what we've done here has been fascinating. In our 600 plus employees here at Innovaccer, we've, risen to the case of really trying to provide a solution for people to take care. So, I mean, we just brainstormed, and I know both of you have been on calls with us to help us think through this, about how do you assess people at home, give them the material they need to take care of themselves, get them to the right place for quarantine care, and then be able to have, as a provider, be able to get those results right away and risk stratify them and say, who really needs my help now? And then connect with them through a telehealth visit so you can see them and assess them. and make sure they're getting to where they need to be. You know, initially the result is focused on testing. It's really about triage, connecting with people, and we're doing the analytics across that. We're doing that across many different countries, not just here in the U.S., but deploying it to a number of health systems, health plans, and public health systems, to the point we've talked about with public health. So for those in the audience, I just want to say we will send out a little bit of information about this. We are offering these solutions for free as our way of giving back and trying to help out, chip in. There's a limitation for how long we'll continue to do that, I think, just to be able to stay viable, but it's been scaling very rapidly. So I advise you, as you take a look at that, to please take advantage of our contribution to getting this service out for free, so that you can assess people, get them to where they need to be electronically, identify their risk, and then connect with them by telehealth to help with that. So let's just take a few of these questions, because I've seen a number come in. You know, there's a lot of questions like, will you see prior auths going up? You know, will Medicare approve more telehealth codes on the approval list? What's the payer perspective? What do you think that we can just expect from this? Fran?
On the prior auth, I don't think there'll be any kind of overcorrection on that. I think the industry is quite sensitive to you know, the administrative burden that presents for providers. I think prior auths, I think the industry is getting better and better at understanding which works, which of those are really effective, and that's really how it should be approached. It should be done in a very, you know, logical basis in terms of what's the goal. You know, and it's really about areas that tend to be either overutilized for the wrong reasons. And so I don't think there's going to be an overcorrection there. The telehealth, I am cautiously optimistic that not only CMS for Medicare, but I also think for Medicaid, the Medicaid program, that telehealth will be more widely accepted. Likely more stringent requirements, because there's always fear of fraud, particularly with Medicare and Medicaid. And there's a history of fraud, and Patrick knows this as well. He could probably speak to that better than I, but there's always that, you know, that risk, and therefore, you know, there's going to need to be certain protections in place to make sure that it's not abused.
No, that makes sense. You know, almost 2/3 of these questions relate to telehealth, which is interesting. And as I mentioned, we've deployed the solution. It's been remarkably well received. Patrick, you know, any thoughts about this relaxation on HIPAA, and you know, will be able to continue in that direction? Are there risks for people in doing that?
Yeah, I mean, so I think, you know, my hypothesis is you're sort of seeing maximal, if you think about a baseline, you're sort of seeing maximal, or trying to provide, you know, significant flexibility across rules, regulations, telehealth, HIPAA, et cetera. Yeah, I think it'll come back some, like once you get the crisis, I think some of those will be rolled back, but I still think you'll be at a much different place than baseline, and that will be the new normal. So that's the short version of what I think will happen. I think that'll be true across public payers, and I think it likely will be true across many private payers. So that's how I view the sort of trajectory we're in.
Great. Well, we were able to get to a number of the questions, but not all of them. I want to just thank both of you gentlemen. Fran, thank you, and Patrick, for giving your insights and participating in this webinar. And thank you, everybody in the audience. We had about 700 people today for attending the webinar. The presentation will be emailed to all the registrations soon, as well as some information about our COVID-19 pre-offering to help you assess, triage, and manage people at home and get them where they need to be if they're at risk. So with that, Thank you, gentlemen. Much appreciated your participation.
All right.
My pleasure.
Thank you. Thank you, everybody.
And to our audience as well. Take care. Have a good